COVID-19 testing has come a long way in a short time. The CEO of the Medical Laboratory Professional Association, Michelle Hoad, joins us. And thanks very much. And before we start, I want to give a huge thank you to all the lab workers who are doing these testing, because we talk about frontline healthcare. Those are at the very front of the line, right?
Absolutely. Good morning. Yes, and the other exciting news is we just hit 10 million tests today for COVID. So it is a big milestone today across the province.
Right. How many hours extra are our lab professionals working right now, and how's it affecting them, first of all?
So we started the pandemic, unfortunately, understaffed. So we have a group of lab professionals, so technologists, medical lab technologists, and medical lab assistant technicians that have been working 24/7 for the last 12 months. So when we think about that, a lot of us, unfortunately, have not had to experience that, but our labs are working and doing whatever it takes right now to get those tests across to everyone in Ontario.
And the tests are changing a lot. We're hearing a lot of variant testing right now. So how does that go? When you get a sample, are you now looking for variants as well as I want to say like the original COVID-19?
Right. So when we test for COVID, we use a PCR test. Everybody uses that terminology now. It seems to be in everyone's household. So we actually created that. And so now what's happened is we've created a PCR test specific that looks for the variant. So what is happening across the province is as soon as a positive COVID test is discovered, it's sent to Public Health Lab in Toronto. It then goes through a special PCR test, and then it's sent off for genome sequencing. Those sequencing locations actually are at McMaster and Mount Sinai. So they then get further testing to see which variant it actually is.
Okay, and what is PCR testing? I'm not familiar with that term.
Oh, so PCR testing is the actual testing of the virus itself. So a special test that we built to ensure that it is a world-class test. It is used across the entire world, and everybody's using it to determine if you have COVID. Different than our rapid tests, which we're using now.
Okay, and the rapid tests, so I can understand, oh, of course, they give a result much more quickly, but are they as guaranteed, I guess? Are we getting false positives?
Definitely. So one of the limitations with the rapid test is the reliability, but it also provides you an opportunity to know if you're positive very quickly. So the best place for us to use them would be in our schools, in our long-term care homes, places where if there's an outbreak, let's test everybody in that location right away to see if they have it. We are rolling these out now, and the exciting thing is the more our employers get them, the more they actually go out across the province, we should start to see a little bit of hope and life get back to normal.
Right. And so the rapid tests, are they the ones that go like all the way up, or is that like a swab of the cheek and a little bit of the nose?
A little bit of both, Annette. Actually, you're right on. So the nasopharyngeal swab is the one that gets right up into your sinuses.
To your brain?
That's right. I just had one a couple of weeks ago, and it just reminds you you're alive, that's for sure. And then the other one they're using actually is just a nasal swab. So definitely two different variety of tests right now.
Okay, and where can people get tests? Is it as easy as going to a drugstore soon and getting them, and can you get them so that you could maybe take some home and use them up, kind of thing? Where are we at with that?
Great question. So what you're talking about are home care tests. Those have not yet come to Canada. We've heard a lot about them because they're being used just south of us in the US. So the rapid tests we're talking about still need to be administered by a healthcare worker. So we just need to be patient. The good news is that this is still another tool that's going to help us get back to normal here in Ontario.
Okay, because the other ones it's almost like a pregnancy test, right? You can just get them off the shelf and use them at home. Are they not that reliable yet? Is that why we're not using them?
Yeah, so we have pretty stringent controls here in Canada. So we're not going to accept a test in our country unless we know it's fairly reliable. We are using these rapid tests that do have limitations to them. But again, if something's fast, it doesn't necessarily mean it's accurate.
Okay. How do you feel about the testing right now that's happening in Ontario, in our region? Are you excited about it, or are you really, okay, we need to go a lot further here?
So that's a really good question. So we are almost 1 year later. So 1 year later being we started COVID testing last year. So I think one of the important things to understand is we have a big limitation here in Ontario. So we have 5 programs across the province. They all have wait lists. So there isn't actually a school that resides between Toronto and Windsor. So there's a big gap for us, especially in the southwestern Ontario region. If, let's say, there was another program that had opened up and we had much more qualified medical lab technologists out there, our testing could have looked different. So we've done 10 million tests. If we were properly staffed, if the schools had more seats, could we have done double of that? Those are the kind of questions we need to start asking ourselves, because 1 year later, we definitely are doing extraordinary things. But if we were staffed differently, it would have looked different.
Okay, let's hope that changes for you. And thank you again, and to all of the medical lab technicians that are working for us. Thank you, Michelle.
Have a good day.